Hello, everyone. I am Daedria, your medical billing mentor. So, our topic of discussion for today is going to be: have you completed a medical billing class and still can't find a job? Why am I asking this question? So, the main reason I'm asking this question is because my medical billing students have expressed their concerns to me that they're having a difficult time finding a medical billing job. And I really believe the reason for that is because it's a new career for them. So we all know that starting a new career can be very difficult to get into because most employers are looking for candidates with 1 to 3 years of experience. And so I decided to do a video on this, and these are some of the things that came to my mind, or at least some of the questions that came to my mind when I decided to make this video. So, number one question is: do you have a cover letter? Um, a cover letter is a 1 to 2 paragraph letter explaining your interest in the role as a medical biller. Number two, how is your resume designed and set up? Do you have those key words that employers are looking for on your resume? So, what I normally do is customize my resume with some of the key words that's in the job description of the job that I'm applying for, because the job description has exactly what the employer is looking for. It's probably some of the job functions that you have done before if you have some experience. You just didn't have it on your resume. So, number three, what are the jobs that you are applying for? And this is very important. Um, Number three is very important because it makes a difference in the jobs that you are applying for in your search engine. And the reason I say it's important is because a lot of my students think, because, or a lot of people, not just my students, they think that, okay, I just completed a medical billing class, so the only jobs that I'm gonna put in my search engine is medical billing. But that's not always true, because as a in the healthcare field, there are many positions that you can apply for other than just medical billing. And so here are some that I would suggest that you put in your search engine. And other than just medical billing, that can be a payment poster, a medical collector, a refund specialist. You can even start as a patient registrar or a patient appointment setter. So these are the types of offices you can apply for, which is, of course, a medical billing office, a clinic, home health agencies, insurance companies, medical billing companies, medical group practices, nursing homes, physician billing, hospital billing, and then also these are some of the specialties you can apply for: oncology, neurology, orthopedic, ENT, which is ear, nose, and throat, general practice, etc. And so most of my students told me that they have found a position as a patient financial services. So I would say that this is a really good place to start, just to get your feet in the door. And I'm going to say it again: as a patient financial services representative. Also, as a patient registration. This is a really good place to start also. So what you want to do is you just want to start somewhere in the healthcare field to get your feet in the door, and then you can always move up as a medical biller. You don't always have to jump out there just trying to start as a medical biller, because, as I said before, some employers want you to have, you know, some years, maybe 6 months of experience. And so if they see that you can have some of these other jobs, or getting your foot in the door, just getting started in healthcare, that can give you what you need as a boost to start as a medical biller. Okay. Um, Also, I would say this: sign up with temp agencies. temp agencies are really good at hiring what I call a newbie, and that would be you if you're just getting started as starting your career as a medical biller. So temp agencies, I would say start off with, and they will be a good candidate because they hire, and most of their jobs are temporary to permanent, which means that they'll hire you on a temporary basis. And if the employer that you're working for or working under as a temp, if they like you and if they have a permanent position comes available, that they will hire you as a permanent employee. So that's why it's very important to sign up with temp agencies, because the job could start off as temporary, but it can also end up as being permanent. So that's what we call temp to perm, which is temporary to permanent employment. And if not, even if you don't get hired permanently, you still have the assignment that you applied for and that you're working under the temporary assignment. You have that job, and at least you will get the on-the-job experience you need just by working assignments through temporary agencies. Okay, so that's very important. Always, try to sign up with temp agencies also as a medical biller and some of the other names that I threw out there at you. Just kind of have to go back through this video to look at the names and listen to some of the names that, I said you should be applying to. So number 4, then you must be able to pass a job placement test and what they call an intelligence test. So intelligence test is what they call an assessment test. And number 5, once you have done all of these things prior to what I just named, prior to number 5, once you land the interview, how are you interviewing? So if you ever get this far, you need to ask yourself, how am I interviewing? So this would be my suggestion. Well, first off, are you nervous? Are you afraid? Are you jittery? And my advice to you would be to just relax. Just relax and be confident in the interview and just answer the questions they are asking to the best of your ability. So think about it like this. You're interviewing them, the employer, as well as they are interviewing you. Okay? You must know how to articulate yourself and speak medical billing terms with the employer. For instance, you must be able to explain certain things, medical billing, that they're asking you, such as what is a copay, what is coinsurance, what is deductible, etc. Now, I'm not saying these are things that they're going to ask you. I'm saying that these are medical billing terms that, just in case they do ask you, you need to be ready and you need to be able to explain to the employer some of these things that they're asking you as far as medical billing terms. And if you just completed and passed a medical billing class, actually these are things that you should be able to answer. Okay? So, number 6. Are you lacking experience? If you're lacking experience, if so, I can help you with these things by working with you and mentoring you, allowing you to gain the knowledge, skills, and experience you need under my business, Medical Bills Auditing Service, LLC. I can also give you guidance on your cover letter, guidance on your resume, and how to pass the pre-billing test. Because some employers, not all, will give you a pre-medical billing test to see exactly how much you do know. And if you could pass that test, then possibly you could land that job. So, these are things that I can help you with. Like I just said, I can help you with your cover letter, building an awesome cover letter. I can help you build an awesome resume just so you can get an interview. And once you get an interview, I can teach you some of the things that you need to know as far as how to have that discussion, that medical billing discussion, as I said earlier. Speaking medical billing terms is just things that I could teach you that I know you should know that they possibly will go over in the interview. So, just reach out to me. And as a mentor, these are things that I can help you with. Okay. So, and I think, my next, maybe that's what I do. My next video will be how to pass a medical billing pre-test. So stay tuned for that. And this is pretty much all I have for you today because I just kind of want to jump on here and give you some pointers on and make you aware of why you can't land that medical billing job. Okay. And as I said before, that that'll be my next video, how to pass the medical billing pretest. But also uh, put in the comments or make a post under this video on what some of the things you think that you need to discuss or what you think you could do better. How can I help you? How can I mentor you as far as knowing what to do and I guess just having that discussion on what can I do to help you to land that medical billing job that you're looking for as far as the reason you took the class. Okay. So anyway, this is it. This is all I have. And just look for my next video, how to pass the medical billing pretest. Okay. That's it for today. Bye.